Hi, and welcome to another edition of Your Health with Dr. Christy. My name is Dr. Christy Reisinger, and today I'd like to have an honest discussion about the injectable anti-obesity medications that are so wildly popular. The first, of course, is semaglutide, also known as Wegovy, and the next is tirzepatide, also known as Zepbound. I think there's been a misconception that's been brewing that these medications can be used for the casual dieter, the casual person that's looking to lose 10 to 15 pounds. And I just want to say that that's not what these medications are designed for. These medications are powerful and can help patients lose a lot of weight. And they're designed for patients with a BMI greater than 30 or a BMI greater than 27 for those that have health conditions like hypertension or high blood pressure, diabetes, elevated cholesterol, and things like that. When I start patients on these medications, I help them understand that these injectable medications are likely going to be continued for life. Now, that doesn't mean we won't be able to lower the dose, but they need to wrap their minds around the fact that the treatment of obesity as a disease means that the medications that we used are used lifelong. Just like when you start a blood pressure medication and your blood pressure becomes controlled on the medication, you don't stop the blood pressure medication. We know through studies that when patients stop these anti-obesity medications like Wegovy and Zepbound, that the patients will gain the weight back. And let's talk about side effects of the medications. The main way that these medications work is that they slow down the gut transit, meaning it takes food longer to pass through the stomach. So the main side effects are related to the gastrointestinal system, things like nausea, vomiting, diarrhea, constipation. And lately there's been a concern about a condition called gastroparesis, which is severe delayed gastric emptying that's incredibly painful for patients. In my practice, I've mainly seen gastroparesis in patients with type 2 diabetes, and about 1% of patients with type 2 diabetes have gastroparesis. So I can see how patients that have been using these powerful medications to treat their diabetes in the past would be more predisposed to develop gastroparesis, possibly on these medications. Now, when the medications are stopped, most of the time the symptoms resolve, but we can't guarantee that that will always be the case. And patients that have gastroparesis have severe nausea, severe vomiting, because the food in their stomach just lingers for hours and hours and hours. So one of the things I'm mindful of when I put patients on these medications is that, sure, I expect some amount of nausea from these medications as patients adjust to them. And I'll even prescribe an anti-nausea medication for a period of time. But for those patients that have severe nausea and vomiting, I think the medication just simply needs to be stopped. There's also an increased risk of pancreatitis and also an increased risk of thyroid cancer and possibly pancreatic cancer as well. So these medications aren't without risks. And even though the GLP-1 agonist semaglutide has been on the market to treat diabetes for 15 years and on the market for 8 years to treat obesity, the data for very long-term use of the medications we're still collecting. And then tirzepatide is a much newer medication. It was approved for diabetes in May 2022, but was just approved for obesity last week. So the long-term data about using these medications we're still collecting it. As with all medications, the pros of the medications need to outweigh the cons of the medications. For me personally, patients that struggle with obesity also have risks of not treating their obesity, such as diabetes, high blood pressure, cardiovascular disease, and increased risk for cancers. But as I hope you're realizing, these powerful anti-obesity medications are not to be used casually. They should be used with a physician that's aware of the potential side effects and risks. If you're looking for a physician trained specifically in obesity in your area, go to the Obesity Medicine Association, and I'll put that link below. Thanks for joining me.